And then let me go
We
ahead and
are. Hello, everybody.
happy Friday.
Yes, happy Friday.
Now I'm gonna work on, all right. I think how
Uh-oh.
are you doing it, YouTube? If anyone's out there on YouTube, and hello, we are live on Instagram as well. Hi guys, how are you? How's it going?
I just sent you a request to join Instagram.
Okay, got it.
Great.
Hi. Hi guys. Happy Friday. How are y'all doing today? Happy Sickle Cell Awareness Month.
Yes.
Hi, X Tree. I'm glad you're doing good. Oh my gosh. Hi, Vineski. Hello. Drop down in the comments where you are tuning in from. Hopefully some of those exotic places so I can live vicariously through you all. Well, go on, Sister Warrior. I'm getting infusion as we speak. How's infusion going? Nice to see you. All right, so you guys know the spiel here. Any questions you have for Dr. Q, feel free to go ahead and put them in the chat. How is your Sickle Cell Awareness Month going? I know we celebrate it here in the US, but I think other parts of the world are celebrating it as well. Oh, Ghana. Nice. My enemy. Now I'm playing. I'm Nigerian.
There's someone from Nigeria.
All right, so let's go ahead and get started with our very first question. Can sickle cell crisis damage can sickle cell crisis cause damage to the body? If so, what damage does it cause?
Well, sickle cell crisis is you assume people are saying pain, but a lot of people use that term for anything that happens to you when you're having sickle cell disease. But yes, if you have pain, it means that blood vessels have been blocked and the tissue on the other side of those blood vessels that aren't getting the blood are dying. And when they do that, it causes inflammation and stimulates your nerves, and that's the pain. So, depending on where it is, it can be damaging. For instance, if you have chest pain, it could be infarct in your ribs, or it could actually be in your lungs, acute chest syndrome. And it's not really easy to determine whether someone has acute chest syndrome versus pneumonia. Um, it kind of takes a little bit to figure that out. So everybody that has chest pain has an abnormal chest X-ray, they're assumed to have acute chest syndrome. Um, and somebody says, yeah, my lungs are damaged permanently. And, that is a big problem with sickle cell disease. As you age, all these things that the pain that you have, the acute chest syndrome, if you have it over and over, if you're getting transfused, you can have iron overload, which is really dangerous. Um, so I know someone who takes hydroxyurea just to preserve her body,
Are you
and
talking
there,
about
and
me?
there she is.
I was like, that sounds familiar. So, in short, yeah, sickle cell, the pain isn't for nothing. There is damage that's being caused while you're going through a sickle cell pain crisis.
And it can be something like a bone infarct or a muscle infarct, which isn't going to cause permanent damage. But if it's in an organ that like your lungs, your hip, your liver, that can be damaged, that can be permanent and can lead to more problems. Which
Okay.
is why which is why everybody who has sickle cell disease should be taking something. My favorite, if you've ever watched this before, is hydroxyurea, but taking something that will um, decrease the amount of problems that you're having with sickle cell. And anything, it turns out, it's kind of not surprising, but it turns out the higher your fetal hemoglobin is, the fewer pain episodes you have because fetal hemoglobin, because it doesn't sickle, it increases your total hemoglobin and it carries oxygen. And it also, when it's in the red cell, it inhibits sickling because it's not hemoglobin S, it's hemoglobin F. So so hydroxyurea increases your fetal hemoglobin and decreases pain and damage to your body. There are new actually oral drugs coming out that will significantly increase your fetal hemoglobin, much higher and more consistently than hydroxyurea. They're in the study stage right now, but in a few years they'll be out on the market. And of course, gene therapy, bone marrow transplant, those things uh, in not they can increase your fetal hemoglobin and also change your hemoglobin from sickle hemoglobin to whoever the donor was.
All right, Aisha, I see your question. What is the LDH blood test? I love this question. What is the LDH blood test and why is mine always elevated?
LDH is it's called lactase dehydrogenase, and it is released when you have hemolysis. So it's kind of one of these markers of hemolysis. So when you look at studies and they want to know whether the medication or the treatment decreases hemolysis, one of the things they look at is LDH. Um, and so if your LDH is really high, if I was if this was a test, I would say your hemoglobin is probably low as well. Um, and again, that hemolysis can be decreased by my favorite treatment, hydroxyurea. Not as it's not nothing's 100%, but it is uh, very helpful.
So, in other words, in hemolysis is when, the blood is breaking down quickly, our cells kind of burst. And so it's that that's happening. And so LDH is associated with cells breaking down, essentially.
And it can be released by the liver as well if you have liver disease. But in sickle cell, it's more commonly associated with hemolysis or cells just basically coming apart.
Okay. That's a great question. I don't think we've ever had a
It
question
is,
on
yeah.
LDH before. Um, does sickle cell cause some people migraines? Yes. No. I always have migraines now.
That sounds like a personal endorsement.
Yeah, right.
Sickle cell disease, people with sickle cell disease do have more headaches than the general population. I can many, many years ago, 20 plus, whatever, um, the neurologist at Children's Hospital in Oakland looked at his referrals from the sickle cell program for uh, people with sickle cell who had headaches and told us he never published it, but he told us that people with sickle cell disease at Children's anyway seem to have way more headaches than the general population.
And migraines is part of headaches.
Yeah. Somebody asked a question. I'm going to have to look it up.
Well, just from my own personal experience, but I've been noticing this more as I get older. I do get like more migraines and more headaches. Um, so I don't know if it's an age thing or, if that's something where it's like generally, you know, I think the study you just talked about, Dr. Q, was a pediatric study, correct?
That's right.
Okay, so it's not just an adult thing. So yes,
No.
headaches are people, unfortunately, we're not exempt from headaches either. Um, should I move on to the next question or should I
Go
uh
ahead.
just okay. Um, I love this question. What are some of the benefits out there for people with sickle cell? And actually, maybe I read that it's differently than what you meant, but are you talking about like resources? Like what people with sickle cell are eligible because of disability? Is that what you mean? Or do you mean like the benefits of having sickle cell, like natural selection and, or sickle cell trait rather? Um, but in terms of benefits, Dr. Q, what benefits do you know of that are available for, people living with sickle cell?
Oh, you mean what is available for people, not
Yeah,
not the
like
benefits of having sickle cell disease?
does anybody want to answer that, the benefits of having sickle cell? I just I have an answer to that, but I've been
For an outsider, what I see one of the benefits is community
mm.
because everybody, nobody, you're people with sickle cell disease are this unique community that nobody else can understand. Nobody else experiences what they experience, and only another person with sickle cell disease has any idea about what you've gone through in your life. Um, so I would say community is a very important part of having sickle cell disease. So most people don't have that kind of a close knit community. Yeah, it's complicated, but in addition to that, most people or many people who have sickle cell disease are Black. So that adds, it's a very interesting social
So
phenomenon.
she's talking about resources.
Yeah, so resources, there's all kind, it depends. If you live out in the middle of North Dakota, probably you don't have a lot. But if you're, say, in California, there's a lot of resources. There's sickle cell centers, there's which you can you can go online and find out where there's a sickle cell center near you. And a sickle cell center has social workers, hematologists, pediatricians, and a whole array of people who can help you out. Probably the and there's also community-based organizations. In California, there's a community-based organization called Cayenne Wellness, and they provide free counseling for people all over the state who have sickle cell disease. Um,
I
there's
can share some benefits.
what?
Disability, you're eligible for
Oh,
disability.
that's right.
You're
Yeah.
eligible to apply for disability. Also, I have a disabled placard that I use, like if I'm, my leg is swollen or my knee is swollen and I have to get into the store. So, disability placard is another one. There are special like educational, I forget what it's called. I think it's called
Well,
rehabilitation center or something where so some of this was back in the day. I don't know under this administration if this still exists, but it doesn't hurt to look this up, but they pay for my school. They pay for my classes, for college classes, and so I got that due to having a disability. My mom was like big on like what resources are out there, and stu what is it? Student disability if you're going to school. You have accommodations for work as well, and protection under the ADA. American Disability Act. So there's a lot of things. I would say, the US is probably one of the best countries for individuals living with disabilities, or what I'm told, one of the better countries in the world, for access to resources and access to, you know, um, anything that's, helpful in terms of having a disability. So hopefully some of those help. Get your handicap placard as an apply. I know last time I went to a meeting. This was a HRSA meeting or HHS meeting. Again, this was before this administration. And they said that they were prioritizing sickle cell for um, applying for disability. So like they use sickle cell as like the model uh, disorder, and they haven't done it with any other disorder outside of sickle cell disease. And so I don't know if that program is still running, but apparently it's supposed to be a lot easier to apply for disability or a lot simpler to apply for disability if you have sickle cell disease. So.
And if you can have a contact with a social worker, some of these programs and stuff require forms, and a social worker could tell you what was available in your state, and they could also help you with applications for services as well.
Yeah. A social worker is the best person to talk to about resources too, because they also know local, some of these resources are so local to wherever you're at too. And so they can kind of, I think at the UCSF they provide, or there's some sort of grant where I can get for a free therapist or a low cost therapist as well to um, talk to, and I probably do need to take advantage of that resource, but I don't. Um, so yeah, check with your social worker. Social worker is a good place to get started, but there are benefits and resources out there for sickle cell. For specifically sickle cell and then also for people with disabilities. So make sure to search under both.
And if you have a child who goes to school, there are programs for kids who have sickle cell, IEPs, and in California, it's called the 504 plan.
Hmm. Okay. Hopefully that's helpful. If you all know of just any resources, please put it in the comments too. Um, Sharing is caring, and I love sharing that. I have a lot of people are like, "You have a disability placard." I'm like, "Yeah, girl, you better get it. Ask your doctor. Like, get get that, and apply for disability." Yeah, just let's just try and make our lives a little bit easier here. All right, so. Let's go back to hydroxyurea because I have a few questions that you all submitted about hydroxyurea. I've been on it for a while and recently learned from other warriors that it may have alarming side effects. I haven't experienced any side effects yet, though. So, is there any cause for concern in regards to that, Dr. Q?
Well, there's the side effects are different for different people. So, what you do have to know is what the side effects are. So when things happen, you don't think it's like lightning out of nowhere. It could be related to whatever medication you're taking. So side effects from hydroxyurea, the most common and the ones that need to be monitored are hematologic. So hydroxyurea can lower your white blood cell count. It can actually lower your hemoglobin if it's too high, and It can lower your platelets in some people. Those are the little things that help you with clotting. So you should have a blood test every couple of months. At the beginning, the way I did it was I did frequent blood tests like every after 2 weeks and then a month and then 2 months just to make sure that at the beginning there weren't any problems. So that's the hematological problems can be tested for. Um, some people complain about hair loss, which is, I think you may just become more aware that you're losing hair all the time. I lose a lot of hair when I comb my hair. Um, and maybe you just never noticed it before. But it can cause hair loss. It can also cause what's called melanechia, or the nails, your fingernails can have either black lines in them. If you're a young lady, it's a good excuse to go and get a manicure and get nice nails. Um, Probably the one thing that is difficult to test for, but does happen, is your sperm count goes down, and it can affect not so much in women, but it can affect your ovulation. You also, um, if you're planning on having a child, then you should stop hydroxyurea. There's never been any evidence that be, in the first trimester, the first few weeks of pregnancy, that it causes any fetal damage, but nobody has taken hydroxyurea throughout a pregnancy that I know. And so we don't know what could happen to a little fetus during that time. Your sperm count can go down. Now, people with sickle cell disease generally have a lower sperm count than people without sickle cell disease. And it doesn't make you infertile, it just makes your count go down. And it's recommended you stop hydroxyurea if you're planning on having a child. Um, and that once you stop, it comes right back up again. So those are the common side effects. Other things like stomach aches or something like that could happen, but they're not. I never had anybody who told me that they had any, except for the hair loss and the nails. They didn't have any other side effects that they could notice. It also doesn't work in everybody. So what you need to do is make sure that it is increasing your fetal hemoglobin, decreasing your white count down to a normal level, decreasing your reticulocyte counts, and it also should make your red cells a little bit bigger than normal, or bigger than they were before you were taking it. And all those things tell you that you're on the correct dose. If those things don't happen, then you might have to have your dose increased a little bit. So you need to have a doctor who's prescribing, who knows what to look for, and a complete blood count, questions to ask you about how you're doing with hydroxyurea and all drugs. All drugs have side effects of some sort or other.
Okay, I just wanted to briefly follow up on a comment about disability. This person said their daughter's 18. She graduated, and SSI just wrote her last month that she would no longer be considered for disability. So there's a difference between SSI and SSD. So what I was talking about is SSD. So I would double check to make sure that because she should be eligible for SSD as opposed to SSI. I think they're two separate programs. So double check on that. These are really great questions. The next one I have here is I have a leg ulcer that I'm treating, but the improvements isn't good, just getting worse each day. I don't know how to heal it. Leg ulcers are tough to heal.
They are leg ulcers are really, really, they're painful, they're disfiguring, and they're really hard to cure. And the depending on where it is, like people will put a Una boot if a lot of times they're down around your ankles, so that you don't, so that they're protected from trauma. The other thing is if you're really having a hard time, you probably need to go see a wound specialist. There are people who specialize in wound care. Um, and they take care of, like, people have what's called an ostomy, like they have a tube from their stomach or kidneys or whatever. And these people make sure those don't get infected, and they change the dressings and they take care of things like that. Or they may have somebody who has a burn and they have to change the dressings and all that kind of thing. So if you could get a wound specialist, that would be the best thing. Otherwise, you might there if you're near a hospital, there's probably a nurse. Your doctor can refer you to somebody in that hospital who does dressing changes and stuff like that. Um, yeah, they're very difficult to heal, and they tend to reoccur because when they do heal, the skin over the top, the skin isn't normal. It's very thin and it can break down again. The big thing is to make sure you change it, that it doesn't look infected or doesn't feel like it's painful. Well, they are painful, but at least it doesn't look infected, and that the dressing gets changed as frequently as it needs to be. And you cover it. You make sure that it doesn't get injured more, because um, some people try chronic transfusions, hyperbaric oxygen, and something like hydroxyurea. They do medication. Whether those things make a big difference in skin ulcers is not clear, but having a e- expert take care of them is very helpful.
All right, I have a couple.
If you want to write me at Ask Dr. Q, I could give you some more information.
And that email address is ask@sc101.org.
Yes.
Um, so I do have a few follow-up questions about hydroxyurea. Can hydroxyurea also cause skin discoloration in other areas besides the nails?
Not that I know of. I've never had anybody tell me that.
Okay. I haven't heard of that either. This other one says, my kid has been on hydroxyurea for 3 years, and they have been increasing his dose on every follow-up appointment. Will he be on hydroxyurea forever? His sickle cell type is hemoglobin SS. So it sounds like they're trying to find the maximum tolerated dose for him. Is that correct?
Right. And as kids grow, the dose is based on weight. So as kids grow, they weigh more, so they increase the dose. And like Cassandra said, they may be trying to determine what is the maximum tolerated dose, or the highest dose we can give without causing side effects. And sometimes if people do that, then it more blood tests and a lot of changes in the dose.
So yes, and I just want to make sure that we know collectively on this live that you may start off with one dose of hydroxyurea, but you may change it. I've changed my dose probably 3 or 4 times throughout the course of when I've been taking hydroxyurea. And that dose is based off of weight. And so, dosing can change within hydroxyurea, and that's completely normal. So if you're startled by a change dose, sounds like the provider is doing what they're supposed to be doing and making sure that you are getting the right dose. Sometimes you have to take less. Sometimes, they want to see if you can take more to get even more benefits. So, that's kind of how it works. It's never just a stagnant dose. Actually, right now I'm taking one capsule one day and then two capsules another day and then one, two, one, two, one, two, one, two. So it's just, and I started off taking like three capsules. So there's, different ways or, there's different doses and, as long as you're staying and touching and getting your labs done, that's what's supposed to happen to make sure you're getting the amount that is most appropriate for you. Some comment says my daughter started hydroxyurea several years after spleen removal surgery and doing well. She is an honorable student, A, and graduating a year early in May
Wow,
2026. That's amazing. Congratulations to your daughter.
that's amazing.
You know, I don't see studies there, but I know we're like smarter than a lot of people with sickles are like our brain is like our biggest muscle. It's our biggest flex. I'm not even joking. Congratulations to your daughter. Well
That's
done.
great.
And I'm sure you're proud too. Good job, Mom. Um, what could I do to stop having priapism crises?
I saw that question.
Yeah.
And I think that person could go to Ask Dr. Q and I could send him some more information. But priapism is really a difficult problem. Um, and it tends to reoccur because you have damage in the circulation to your penis. And that causes fibrosis, scarring, like we were talking about, wherever you have a problem. But I think, I the person who knows your history the best is uh, your hematologist or your sickle cell doctor. And what you should try to get is a urologist who knows something about sickle cell disease and knows something about priapism, because it's a kind of a moving target where it's going to change over time, and what somebody recommends at point one may not be still working at point two. So you need to be followed for that. It's really a very, very difficult problem. And if it's not initially uh, aggressively treated, then even sometimes if it is, it becomes a chronic problem. It's really a bummer. But I think a urologist who knows about priapism, knows about sickle cell, and is willing to work with your hematologist or your primary care doctor, that would be the best thing. But send me ask Sickle Cell 101. I'll send you some information.
So it's ask at S like Sam, C like Charlie 101.org.
Yeah.
Okay. So the next question I see we have here is, hey, Dr. Q, what is ACR kidney test?
ACR kidney test. That is an augmented renal clearance. And what it I think what they're looking for, I don't, without knowing anything, they could be looking at the clearance of a medication you're taking, because you're taking what they consider to be should be a therapeutic dose, and its metabolism has it excreted renally, and they want to know whether or not you're losing a lot of that uh, from your kidneys. Um, that's it's also people with sickle cell disease, their creatinine clearances, because people with sickle cell disease make more urine and it's not dilute, their creatinine clearance, which is a measure of your kidney function in people who don't have sickle cell disease, is not very accurate. So people do other tests, and something like an augmented renal clearance may be something they're looking because they're not sure about the other routine um, tests that they do to check the function of your kidneys, and they want to know I don't know. I'm not a urologist, so this is kind of a way out of my field, but they want to know whether or not or how well your kidney is functioning in terms of clearing uh, drugs, etc. But that's all I know. Be a good question to ask the person who ordered it. What is this, and why did you order it on me? You got to do that. Doctors don't. A lot of times
Yeah, they
doctors
just
aren't forthcoming with information. So they talk their doctor talk. You have no idea what they're talking about. So you've got to stop them and say, hey, wait a minute. What did you just say? What does that mean? Um, and most, especially sickle cell doctors, most doctors realize that they talk this doctor talk, which is kind of annoying sometimes, but you get that's the way you talk to everybody in the hospital, so you forget, oh, this person probably really doesn't know what I'm talking about. I should get rid of some of this doctor jargon and tell them what's really going on. You got to remind them to do that though, because
yeah,
it's,
I would say, hey, so what's that test for?
yeah,
What does it
right,
do? What do
right.
you think I need it for? Yeah,
Yeah, and for everything, if someone's ordering a test and you're not sure why or what, you got to say, hey, why are you ordering that? I've never had that test before, or I don't know what that test does. I'm just
um,
hearing an echo, but I don't know where that was
yeah,
coming
I was
from.
hearing that one too. Um, okay. These are great questions. I can't wait to get through all of them.
They're always great
Yeah.
questions.
Yeah, but like some of these have words I can't even pronounce. That's like how awesome they are. Um, Next question. What can family and friends do to help our loved ones with sickle cell? I like that question. That's a
Yeah, that
really great question.
I think what it depends on, but Cassandra could answer this better, but I think it depends on how much your family and friends know about sickle cell. I think even though it's a relatively, well, it's actually an orphan disease, but there are a lot of people in some areas who have sickle cell. I don't think everybody really knows the details of sickle cell disease. So that would be
Yeah.
the first thing, to let people know what's going on. And then that will also weed out the people who may not be up for it. And then I think, don't turn people away. You gotta, sometimes you feel like I can do this myself. I don't need any help. And someone's asking to help you. But that's the person that you want to be friends with and talk to and let them help you. If they want to do something, give you a ride, do something for you, let them do it. And then that develops this relationship so that maybe in the future you have to go to the hospital and you can't find any way to get there, and you just call them up and they say, oh yeah, sure, I'll drive you there. So
Yeah, I always think, you should never be in the ER alone. And so anybody who's willing to, go with you to the ER and be a support in that way is always a valuable person. But again, like Dr. Q says, they should know a thing or two about sickle cell and it should be able to articulate what you're going through. And just kind of help take some of that burden off of you as a patient. Because uh, it's just you're getting asked all these questions that maybe somebody else can help answer for you. Oh, what's your height? Oh, she's 5'7". What's your, like while you're in pain, it's just like you don't want to
right.
talk. Um, so yeah, just having that support. Ask your loved one with sickle cell what they like. Some people might like nice rub or touch, if they're in pain, but I hate that, and I think people automatically try and like go, okay, and like it sets me off. Like I'm like, don't. Because I'm already overstimulated with the pain. So you adding like a more sensory to it is just like it's too much for me. So definitely ask, but some people love it. So definitely ask, your person with sickle cell how they can help because it is an individual thing and different people need different things. Some you can pack, some people just need an ear to you can say, how's your pain? How does your pain feel? Like asking thoughtful questions, showing interest is always like, I love that, because then I can really, I feel like a lot of people don't get a chance to voice how painful things are, or voice how difficult the disease is, and we kind of just keep it pushing. And so when somebody asks, oh, hey, how are you doing? How's your sickle cell? Like, but like those specific questions, it's nice sometimes to be able to kind of just vent and share your frustrations and share whatever you're going through. So yeah. But that's a great question.
Yeah, and you should always have somebody, if you can, be with you when you go to the emergency room. It really makes the interaction between you and the emergency room physician changes if you have someone
Yeah.
there, because then there's two people, and if you're in pain, things may just go by you because you're in pain, and so that person can help um, with letting the doctor know. You may not even want to talk about it, letting the doctor know what's going on, and also having kind of a witness sort of
Mm-hmm.
changes the way the interaction goes. If you're there by yourself, it's people, doctors are human and sometimes they're busy, they're thinking about some other patient, but if you got someone there to keep them on track with you, then that's good. It's hard to do that when you're having some kind of sickle cell event because you're sick, you know.
Or, if somebody can't be there with you in person, being there on the phone with you and listening in on conversations and all of that, I think that can be helpful too. Um, all right, going down the list here, does sickle cell stop you from gaining weight?
It can. I mean,
I want to say yes and no.
I mean, it's, depending on what kind of sickle cell you have, but if you have hemoglobin SS, you have a relatively increased metabolic rate because you're making a lot of red blood cells all the time. You're constantly anemic and your body is always making red blood cells. That takes a lot of energy. Um, but if you have a different kind of sickle cell, like a C or something like that, then you don't have that hemopoietic drive, and so it doesn't. Oh, and I think a lot of people with sickle cell disease, they are, as kids, they tend to be a little bit thinner, but as they grow up, I I couldn't tell you what an adult with sickle cell disease. Some people just if it depends on how much pain and stuff you have. You probably don't want to eat if you're sick or have headaches or whatever. But I don't think sickle cell in and of itself has anything to do with your weight. There's people with sickle cell who are a little overweight. So
Yeah, I was gonna say, I know people with both who are like extremely sick. I was extremely skinny growing up. I'm who Dr. Q, I'm like a representation of what Dr. Q was talking about, just like very, very skinny. People call me stick. Now I wish I had that problem. Now I have like I'm trying to get back to where I used to be. So yes, you can be very, very skinny with sickle cell, but not necessarily all the time are you, different people, different bodies. My sister wasn't ever skinny and she has sickle cell. So she wasn't like thick skinny like me. She always, had a good weight to her. But I was clearly underweight. So,
And kids who are underweight go through puberty later.
and that was me too.
So if you're a little bit on the thin side and what generally people with sickle cell disease go through puberty later, but if you're really thin, it'll be later still. So, but you always go through puberty. You know, um, I've had kids who I actually was worried about. Hey, maybe this isn't, we should test to make sure that this kid doesn't have something else. Because they were like, 18 and they hadn't really gone through puberty. So there is a point at which you kind of have to decide, well, maybe this isn't sickle cell, it's something else. But he went through puberty without any problems.
Hey, can sickle cell damage the liver?
Y- Uh, yes, but the thing that probably damages the liver more is iron. People who have sickle cell disease, you can have you can have your gallbladder. You have a lot of hemolysis, so you're making a lot of bilirubin. Your gallbladder, which is you could say is part of your liver, you can have gallstones, which can be painful. The other thing they can do is they can get stuck in the bile duct so that bile, the yellow stuff that your liver makes, can't get out of your liver. And then that can damage your liver. So you have to have cholecystectomy, take the gallbladder out because it's causing a problem. You can also have gallstones up in the liver, which is a bigger problem. These are kind of rare things, but yes, sickle cell disease can cause liver problems. But more damaging generally is iron because everybody who has sickle cell disease over their lifetime, they get a lot, a lot of transfusions compared to someone who doesn't have sickle cell. So you should be asking your doctor when you're late in your teenage 20s, whatever, if you've had more than 10 transfusions or 12 transfusions, and you're continuing to get them even once or twice a year, what is my ferritin? Am I iron overloaded? Um, and that iron can damage your liver, can damage your heart, your pancreas. So people who are really iron overloaded will have diabetes, heart disease, liver disease. It's totally preventable because there's an oral medicine you can take to get rid of the iron. You got to take it every day. It's kind of a hassle, but it's better than having iron overload for sure. Back in the day, there wasn't any um, oral medicine, and you had to stick yourself with the needle every night, and a lot of people didn't want to do that, and so there was a lot more iron overload than there is today. But there's still iron overload in people, and they die from it, and they shouldn't because if there's an oral drug to take care of that. And if you're having trouble with that, getting the medicine or taking it, you really need to talk to somebody and try to figure out how you can take care of that. It's just gets worse and worse and worse. It doesn't get better by itself. Your body has no mechanism to get rid of iron. Once it's in there, it can't come out without this medicine.
All right. Next question we have up in the queue is I have sickle cell disease and recently have had problems with my eyesight. Can you tell me what's happening?
Uh, I can't, right? But an ophthalmologist could. So if you're having trouble with your vision, it could be like you need glasses, right? But it could also be something called retinopathy, which is damage to the back of your eye where you see, from your sickle cell. Everywhere there's blood, you can have problems with sickle cell. So there are these tiny little vessels on the back part of your eye and the retina that can be damaged. And then those vessels come off the back of your eye, the retina part, and they're trying to come back down and get more oxygen to the rest of your eye, but they are very friable and they can bleed. And so then you can have problems with bleeding and damage, eventually real damage to your eyes permanently. So if you're having anything, this is, boy, I hope there's a lot of people listening to this, because if you have anything going on with your eyes, you really need to see an ophthalmologist as soon as possible because they can look in there and see whether or not this is going on. There was a question that I saw come up asking if they should have a fluorescein eye
That, oh,
exam.
I'm glad you, because I didn't know how to say that word,
Yeah,
fluorescein or whatever.
fluorescein. So
Yes.
it's a dye that they put in to look at your vessels. I mean, the vessels are really small, right? So even if you're an ophthalmologist and you're using equipment, you can kind of see them and you're pretty sure where they are. But the fluorescein is a dye that goes into your vessels in your eye, and they're crystal clear. They can tell where the bleeding is, whether vessels are compromised. And if an ophthalmologist or a retinologist, someone who works just with the retina in the eye, wants to do that, it's because they're not sure what they're seeing and they want to make, and the other thing is they can take pictures. So they have a time capsule of how your eye looked on that day. And they might want to do it a year later just to make sure everything is okay. But that's a fluorescein uh, exam. They don't do it very often, and if they do, it means they're having trouble trying to see exactly what's going on. And your eye, once your eye is damaged, it's really hard to repair. So it's
Yes.
someone said, is fluorescein with the dye the only solution? Can't it go on?
Isn't that orange dye that it's carrots?
No, I don't know what the dye is, but it does. You can if you look it up on my favorite, everybody's favorite Google, who I guess can't have monopoly anymore, that you can see pictures. Click on imaging, and it'll show you pictures of fluorescein dye studies. It's not a solution; it's just an imaging study. It's like a chest
Yeah.
X-ray, MRI, something like that. They just lets the ophthalmologist or retinologist know exactly what's going on, and they can use it to see whether things are getting better or worse.
I have retinopathy, or I don't know if it's still active, or I don't know how you say it, but they did give me a dye for my eye so that, for the imaging as well, but they said it was made out of carrots. So that's
Maybe it
why,
is.
yeah, so that's why I
Yeah,
asked you about that.
yeah, maybe
But
it
yeah,
is.
it's just used to get clearer pictures of your eyes so they can really see what's going on. Otherwise, it's difficult. So, it would be necessary to get like the best type of imaging to really understand what's going on. But yes, I think I don't know if it was the anterior retinopathy. I think it was the side. What is the one that's called the side for the side of your eye?
The
Um,
side,
yeah.
the
But
sclera.
yeah, I was diagnosed last year with retinopathy, had the laser exam, cried like a baby, said never again, and will never, ever, ever miss another ophthalmologist or retinologist appointment ever again. So yeah, please keep up. Make sure you're seeing your ophthalmologist or retinologist at least once a year for that. Okay, can you please enlighten me more on chloeolithiasis and sickle cell warrior?
What is that?
Chloeolithiasis?
See it.
It's a CH how does this spell? CHLOE, like spelled like Chloe. Um
Oh,
LITHIA. Yeah. What is that?
cholestasis? Is that what? I don't see it up here. Is it cholestasis?
Let me see if I can pin
It
it.
sounds like it's something that has to do with the gallbladder.
Is that clo mean gallbladder?
Yeah.
I lost the comment. Let me see if I can try and pin it.
So while you're looking,
Here it is.
anterior uveitis, that's inflammation the of the eye, and it could either mean the back of the eye, the retina, or in the front of the eye, around where your the iris is. Um, I'm not an ophthalmologist, but I think that term may be used interchangeably. But so you have to know whether it's the back of the eye or the front of the eye.
I think they said anterior, so back of the eye.
Yeah. It said I looked it up and it said it's a misleading term. The retina is the back of the eye.
Okay,
So
got it.
but anterior means the front of the eye. So you can have uveitis or an infection in the anterior chamber of your eye, like in front of your iris. It actually you can't probably see it, but if you look at it with an ophthalmoscope, you can see a little bit of inflammation in there.
Hey,
Oh, cholelithiasis, is that the word?
yes,
Cholelithiasis means you have gallbladder stones. So chole is your gallbladder and lithiasis means stones.
stone. Okay.
Yeah. So um, I don't, I haven't been in practice for quite a while, but in the day there was kind of uh, what people didn't know whether if you had gallstones, you should take the gallbladder out, or you should only take it out if they were symptomatic, or you should wait for um, some like an obstruction or something more dramatic before you took out the gallbladder. Um, but gallstones, you can have gallstones and they're small and you don't know you have them. But if you have pain in in the area of your liver and somebody does imaging, like an ultrasound or something like that, they can see the gallstones. Um, gallstones, I've had patients that had lots of gallstones for years and well, they actually had thalassemia, this person I'm thinking about. They had gallstones for years and it never really bothered them. They didn't have any pain, they didn't have anything. But when you looked at an image, there was like dozens of little teeny stones in their gallbladder. The problem with having stones in your gallbladder is that they can leave the gallbladder and they can block the bile duct, which causes problems with your liver because then the bile can't get out. Um, Gallstones can also occur, like I was saying, in the liver, and that's even a bigger problem. Um, if it's very symptomatic, or if the gastroenterologist feels like they could block your um, the bile duct, the common bile duct, then it's you could have it removed. Nowadays, they can do laparoscopic cholecystectomies, so there's not a big incision, and the recovery time is pretty short. Um, but that's all I that's what I, that's You've learned everything I know about the
Mhm.
gallbladder kidney, and gallbladder stones.
All right. AVN, is it advisable to do the hip replacement surgery or just exercise it
Eventually,
away?
yeah, eventually, there was an article published by the physiatrist, the doctor, physical therapist, a doctor who's a specialist in physical therapy. And she did this study and showed that by doing physical therapy, you could decrease the pain in AVN significantly. And but they told you how to do exercise, you had to do this stuff at home. It was not a simple thing. Anything that you have to do a lot of tends to be more problematic. Anyway, it worked, but eventually those people went on to have a hip replacement. So it depends, and a hip replacement it's pretty big surgery. Um, so a lot of people don't want to do it. So you can put it off, but eventually you're going to have hip replacement. And um, it doesn't matter that you put it off. The surgeon can still do the surgery, um, but then you've got a years of pain, and do you really need that or not? And you have to kind of, Cassandra could talk about this, but you kind of have to get yourself ready for it. It's a big deal.
Yeah. All right. Next question I have here is what can I do to help my son in pain? My okay, so this person's son has pain in their hand. What can they do to help?
In their hands.
Yeah, her son has pain in his hand.
So that's called dactylitis,
Dactylitis.
and and it's very common in infants who have sickle cell disease, but older children and even adults can have dactylitis. Um, in younger children, basically pain medicine is the only thing you can do for that. Um, I don't think, generally speaking, with really little kids, you don't have to do anything else. Just pain medicine, lots of hydration, um, and it will heal up over time. It takes a while to heal up. Um, and you can very rarely you can have infarcts that can shorten a finger because the bone stops growing, but that's pretty rare. It's very painful. So there's no particular, besides pain medicine, there's nothing else that would help that.
I had a follow-up question about ferritin. Where did I? The question is ferritin same as iron,
Oh,
and does high ferritin cause any side effects in sickle cell?
so ferritin, your body can't get rid of iron, but it can put it into uh, the ferritin is the iron that your body sequesters away so that it doesn't damage your body. Um, but and the ferritin test is to see how much the more ferritin you have, is a reflection of your iron, how much iron is in your body, free iron. A better test is an MRI that looks for liver iron, heart iron, and pancreatic iron. So the ferritin is what people call an acute phase reaction. So it's not very accurate for you as an individual. As your ferritin's going up, you're getting more iron overloaded. But in a general sense, the ferritin is not a very accurate test of the level of iron in your body. The most accurate test is an MRI of your heart, your liver, and your pancreas, those are the things that they usually test to see how much iron is there and whether they're and then predict the amount of damage that can happen. If you have a really high ferritin, it's a screening test, which is easy to do. Um, and so that's why I said you should have your ferritin checked if you have had a lot of um, transfusions. But the ferritin level should should tell the doctor, oh, hey, I better do an MRI to see uh, how high if there's liver in the heart, the liver, the pancreas. So it's an inaccurate screening test for the amount of iron in your body. And it's a funny little uh, way that your body sequesters the iron away from the rest of your body.
Okay. And then you mentioned an iron overload or drug for iron overload. What was the drug? Was it Jadenu or was it X-Jade?
It could both of yeah, those two. I think Jadenu is the most recent one, but those are the
Okay.
common drugs.
Yes. All right. Rounding down, I have a few more questions to ask, but if you have a question that's super urgent, put it in the chat. I'll be scrolling from the bottom now. Usually I scroll from the top and I'll see it. But to get us started, lately I am experiencing, oh, sorry. Is it bad for a sickle cell patient to always be on antibiotics? Won't they get immune?
Oh, uh, I assume the person is thinking about penicillin. Um, you don't become immune, but if you take a lot of different antibiotics, and this would be kind of bad medicine. But if you took a lot of different antibiotics for an infection, the bacteria that are causing the infection can mutate to be immune to those antibiotics. So this happens in other countries where you don't need to have a prescription to get antibiotics, and people are just taking antibiotics for whatever. And then they develop drug-resistant bacteria, which is a huge problem worldwide and in this country. But taking penicillin doesn't seem to do that. It's an older drug that's been around since the 40s, I think. Um, and it doesn't actually, you take it because kids take it up to the age of 5 because the way it works with the cell membrane, it slows down the growth of bacteria to give the pneumococcus is what people are worried about. In order for you to know you have a fever, you know you're sick, and it gives you this time to get to the ED. It will not cure an infection. It will slow the infection down so have time to get the correct antibiotic for your infection. Um, so that's why you take penicillin. Taking a lot of antibiotics for if they're all, for weeks or whatever months that isn't being monitored by a physician can cause some major problems. Um, but being treated for infections and for 2 weeks or 10 days a week, that if we didn't have antibiotics, the world would be a different place. There'd be a lot less people here because antibiotics are lifesavers.
Hey, thanks for the follow. I didn't know that the lives share that. Um, all right. I have an interesting question here. Um, I think we'll use this question to wrap us up. Lately, because there's a lot in this question. Lately, I'm experiencing memory loss, too much hair falling out, fatigue, and many more. Why is it so?
Um, it depends on how old you are, but if you're having memory loss, um, that, they're all different questions. So if you're having memory loss, you need to see a neurologist or your primary care doctor, let them know, and they may want to do an MRI to see if you have what are called silent infarcts. So over your lifetime, some people develop these teeny tiny little strokes. They're so small that I probably have them because I'm older, and the older you get, things happen to your brain. So they're more common in people with sickle cell disease. So what you want to know is, do I have a lot of these small infarcts? And is that the reason why I'm having these issues with memory? Um, then there's also neuropsych testing, where you take a battery of tests, and a neuropsychologist can figure out where your deficits are, and they can actually try to help you out with that. Um, so that's pretty serious, and I would definitely want to see a neurologist, your primary physician, about that. The hair loss is really common. I don't know how old you are, but like I lose a lot of hair. As you get older, your hair thins out. So I don't know what to think about that. You could look at your medications and see what you're taking. Is that a side effect to any of your uh, medications? And then fatigue is really common in people who have sickle cell disease, who have anemia, and it's yeah, I think it's extremely common, and it probably has something to do with being anemic all the time. Like some people are anemic sometimes because of something, but people with sickle cell disease are anemic all the time. So so that's different than what other people experience. So fatigue is really common. Um, but it sounds like you need to see you've got a lot of problems to present to your primary care doctor. Are you really anemic? I mean, is there some reason you have something going on besides your sickle cell? Some people think, oh, I've got sickle cell, so I'm not going to get anything else. I'm already sick, but that's not the case. People with sickle cell disease can have other diseases on top of their sickle cell disease. So when you have symptoms like this, you need to have them checked out.
Yeah, fatigue is pretty textbook when it comes to sickle cell. Um, you guys might notice I'm fatigued right now. So yes, that's very, very common. And so definitely follow up with your provider and um, see what you can do. Fatigue is a hard one to tackle. Like I feel like I need a nap right now, this very second. Unfortunately, I still have work to do. But that's kind of just the realities of sickle cell is, fatigue is very, very prevalent. Hair loss, I'm not quite sure. Memory loss, as Dr. Q said, there's even with executive function, they're finding that people with sickle cell could have, lower executive function. I definitely think I do, where, focus is hard, memory is hard. I've taken tests that have said like I'm like within a good range, right? So no problems, but I definitely know, it is a problem for many who have sickle cell. So
And
um
executive function is the front of your brain uh, makes decisions like, should I drive through that red light or not? And, and somebody with poor executive function would say, there's probably no other cars coming. I'm just going to go through the red light.
I
But
don't know if
that's
that's me.
obvious. But other things, you're in your life, every many, many, many times a day, you're asked to make decisions about things. An executive function means you either have trouble making those decisions or your decisions about things are not the best. Um, so that's what executive function is. Everybody has it. And I think, memory loss and stuff is common the older you get. So I have memory loss. The other day I was thinking there's a drug called crizanlizumab, and uh, there's another drug that was just made by Global Blood Therapeutics that does the same thing. And I'm thinking, oh, wait a minute, both those drugs work against P. What is that? It took me like 5 minutes to think, oh yeah, P-selectin. That's what I knew what it was, but I couldn't
Yeah.
think of that second
Yeah.
word. And so
Selectin.
that's really common stuff like
Yeah. Yes, if you've always wondered why, you can blame it on sickle cell.
that. I can't blame it on anything, just I'm getting old.
Well, for us, we have an excuse. And so, yeah, what is the name of the test, Dr. Q, where you can test for memory loss? It had
No,
like,
so
I think it's called
it's
MoCA. It was a
what?
MoCA test. So I go to UCSF and they're like a sickle cell comprehensive center. So they have like all these. But I think it's like the test is called MoCA and it's used like across the nation and it tests for m memory, I think specifically. Don't quote me on that. But is there any other tests that you think people should take?
Well, I mean, I can tell you what doctors do with old people. They'll say boat, train, lake. Remember those words. And at the end of the interaction, as you're walking out the door, they say, "What were the three words I wanted you to remember?"
That was part of the MoCA test.
Yeah. And so if you can't remember any of them, that's probably not too good. But if you and they told you they're going to ask them, so you're thinking, okay, I got
Yeah,
it.
I kept that stuff in my
You keep saying
brain.
them over and over in
Yes,
your
over
head.
in your
Boat,
brain.
and so my brother, who's about my age, he writes me a lot of stuff about medicine because I'm a doctor, but he goes like, "Wow, I was able to remember the three words at the end of my last exam."
Ah, yeah. Honestly,
But
yeah, that test was fun. I
but
like challenges like that.
memory is, the older you get, your memory just does. If you're very young and you really have trouble with memory, then that's a big issue. And if with sickle cell disease, because you're have neurological problems, you have little strokes, whatever, you really need to check it out.
Yeah. So like, yeah, blame it on selective hearing, but
It
it's a memory thing. It could actually be a hearing thing too. I have hearing loss, so good.
right.
Like no, but one of the questions on that MoCA test was like count backwards from 100
Oh,
by groups of seven. So I was like,
oh, God.
well, is there a time limit on this? And you have to do like at least, eight times jump. So I was like, okay, 100, 93. And then it took me like 20 minutes to think of the next number, but I finally thought of the next number that's below 93. So
I,
yeah,
I would have said, give me a pen, a paper, and a pencil.
you're not allowed. You're not allowed. So yeah, they ask you to count backwards from 100 by sevens on that test. And yeah, that was the hardest part of the test for me.
Yeah, I like that selective hearing. A lot of people have
Selective
selective
hearing.
hearing.
That's what my husband says too. And I'm like, now you know I have hearing loss, right? Like, and maybe a little selective hearing, but mostly hearing loss. Um, all right. Well, if we didn't get to your question today, please feel free to send it. I'm gonna put it here in the chat. Send it to ask at sc101.org. And Dr. Q does such an amazing job um, answering those questions. I know you guys like asking questions on live, but in case there's something. that we didn't get to today, please feel free to send it to ask@sc101.org, and I will switch it over to you, Dr. Q, for your statement.
Okay, everybody. So this Sickle Cell 101 is for uh, sickle cell education only. So we knowledge is power, and if you it actually is really important if you have a chronic disease, especially sickle cell disease. So the more you know
Yeah.
about sickle cell, the better off you are. So I feel like I'm here just to give people kind of advice, information about sickle cell disease so that they know what they should be thinking about. And I'm not advocating any kind of medication or any kind of treatment. I mention them sometimes because people ask, and you hear me talk a lot about hydroxyurea, but I'm not advocating that anybody should be on that. This is just for information only. Um, and we're not here to treat disease or make diagnosis or anything like that. We try to give you just the information for the questions that you answer. Sometimes you could take it back to other people and get a
Yeah,
real,
take it back to your doctor for sure
yeah.
and
You
have
should
that
always, the
conversation.
person who knows you the best is your primary care doctor, and they know your history, they know all the things that have happened to you, and they're the people you should be asking about therapy or medication or stuff like that.
All
Okie
right, guys.
dokie.
Happy
Happy
Friday. Enjoy
Friday.
your weekend ahead. Get lots of sleep, sleep in, drink your water, stay hydrated, and we will see you next time. Take care.
Okay.